Thank you so much. I'm so proud to be here today with all of you to celebrate this May Day. To remember our legacy as this workers' movement, not just in Australia, but internationally, globally as well. I went on my first strike just 3 weeks ago. And to be honest, I never ever thought that as a doctor I would go on strike in my career. It's just an assumption, right? Doctors never strike. Thanks, comrade. And the last time doctors went on strike was nearly 30 years ago, 1998. But we did go on strike. And that speaks to how bad, how shit our healthcare system has got. The doctors feel the need to come out and strike when we never, ever strike. Leading up to the strike, our union had been negotiating with the Chris Minns government for 18 months, trying to negotiate for a better award, a fairer salary that was equal with other states, so we wouldn't keep losing doctors to other states, so we could adequately staff our hospitals with the junior doctors that we so desperately need. But instead of negotiating with our union, they behaved in bad faith. They walked away and they refused to submit a fair award. Damn right, shame. And when they finally did submit an award, it was pathetic. It was friggin' offensive. It was worse than the award we had before. It was going to deteriorate our working conditions even more, if that is even possible. So that our union, ASMOF, announced a 3-day strike, and there was a huge swell of ground support. 3,000 doctors joined our union in the week leading up to the strike. And we had 5,000 doctors take part in the strike across all of New South Wales. And that speaks to this shared experience that all doctors have in New South Wales, that our healthcare system is crumbling, that it is falling apart, and we have to stand up and fight back. Fight back for a better healthcare system, not just for ourselves, but for our patients who desperately need that free public healthcare as well. Yeah. And during the strike we had multiple rallies and we heard some powerful testimony from some of the doctors' experiences. One experience that really stuck with me was an obstetrician who talked about working all week, got called in on a Sunday for her on-call shift. She worked from 8 o'clock in the morning till 10 p.m, finally got home to get to bed, and then a couple of hours later was called back to the hospital for an emergency, where she remained there for the rest of the morning, just to leave in time to drop her kids off at work and then start her 4 weeks of work again. For me, that working under those conditions with such little sleep, that is inhumane. All workers deserve sleep, time off from work to eat and to spend time with their families and to be fairly compensated for the hard work that we do. Personally, I spent most of my working career in the emergency department and the ICU, especially during COVID, and it was brutal. We worked long, hard shifts, often with unpaid overtime, and busy ED departments that were completely understaffed. And I would have loved to have had a break, but we felt compelled to just keep seeing patients because they were waiting such ridiculously long hours for the healthcare that they really, really needed. And so we never ever had a break. We just kept on slogging through, working as hard as we could to try and deliver that care. And so when you're in the emergency department, you're waiting long times to get seen. When you hear in the news about the long wait times that the emergency department has, that's not because doctors and nurses aren't trying as hard as they can to get the care that you need. That's because the healthcare system is falling apart. That's because our government behind us hasn't prioritised that system and has refused to address the need that that healthcare system desperately needs. And it's not just doctors that are bringing this issue to the fore. They're not the ones speaking out. It's nurses, it's paramedics, it's allied health, who have all engaged in strikes as well. And that's because the system really, really is deteriorating. It's falling apart. And you can see that in the high rates of suicide that nurses, midwives and doctors have. We have some of the highest rates of suicide for any profession in Australia. That's because we're overworked, we're burnt out and we're undervalued and we are sick of it. But how does our government respond? It doesn't care, right? They have refused to come to the fore, they've refused to give us what we need. Instead, when we finally said that we're going to go on strike, how did they respond? Initially, they started by intimidating us and threatening us. They sent us emails and text messages saying that if we did go on strike, they were going to report us to our governing body and we could be deregistered, meaning we could no longer practice as doctors anymore. And then during the strike, they had the audacity to lie. They said that nearly 500 cancer patients were going to be denied chemotherapy as a result of the doctor's strike. But that was a blatant fabrication. That was completely made up. Doctors had put measures in place to ensure that the patients would get the safe and necessary care that they needed during the strike. But that didn't stop them. That didn't stop them from weaponising some of the most vulnerable people in our community, people with cancer on chemotherapy. They used them to try to delegitimise the strike and dehumanise doctors. Damn right, Shane. They tried to manipulate the public against us. We were the ones speaking out and saying we need to do better to get the care those cancer patients need. Instead, they compromised that message. And then later on in the strike, at one of the hospitals in Sydney, they engaged in union busting activity. They sent security guards around to get doctors to remove their union badges, take off their union shirts, and rip down union posters. It was the same New South Wales government that not very long ago was applauding us, saying we're essential workers and calling us heroes during COVID. But clearly that was just lip service, because they don't care. When we stand up and say we want better, what do? They do nothing. They demonise us in the media. And so that's why I'm proud to stand here with you today and strike on this day. We did learn a few things from the strike. We learned that the government won't negotiate in good faith. We learned that they won't use their resources to address our deteriorating conditions and address our deteriorating public health system. But we also learned that as workers, if we come together, unite as a united front, that we actually have legitimate power. That we can stand up and fight back. We can speak truth to power. That we can, thanks mate, and that we can stand up and demand better public services. That we can stand up and demand better healthcare. And that we can stand up and demand a better future. Thank you. So when I say safe work, you say safe care. Safe work. Safe care. Safe work. Safe care. Thanks.